understanding inflammation, what it means for you. Hey there, have you ever heard the term inflammation and thought, okay, but what does that actually mean for me? Maybe you've seen terms like CRP or ESR on a blood test and wondered if they really matter. Well, today we're diving into the world of inflammation, what it is, how it affects your body, and what you can do about it. Let's break it down in a way that actually makes sense. So first things first, you have probably heard the term inflammatory markers. What exactly are inflammatory markers? Well, they're like little red flags in your blood that tell doctors, hey, something's going on here. When your body is fighting an infection, dealing with an injury, or facing a disease, it triggers inflammation. Inflammatory markers like C-reactive protein, CRP, erythrocyte sedimentation rate, ESR, and plasma viscosity, PV, help doctors detect and track this inflammation. They're super useful for diagnosing conditions like arthritis, autoimmune diseases, or infections. But here's the catch. They don't tell you what is causing the inflammation, just that it's happening. Think of it like seeing smoke. You know there's a fire somewhere, but you still have to figure out where it's coming from. Now, not all inflammation is bad. There are two main types, acute and chronic. Acute inflammation is your body's quick response to an injury or infection. Let's say you twist your ankle. It swells up, gets red and hot. Classic signs of acute inflammation. It's your body saying, all right, we've got damage here, let's fix it. Chronic inflammation, on the other hand, is the sneaky one. It's long-term and often low-level, meaning you might not even notice it at first. Over time, it can lead to bigger health problems like heart disease, diabetes, or autoimmune conditions. Some common symptoms: fatigue, joint pain, weight changes, skin rashes, and even mood disorders like depression. So, if you've ever had a blood test that checks for inflammation, chances are you've come across CRP, ESR, or PV. But what do these actually measure? Made by your liver, CRP levels rise quickly when there's inflammation, making it a great early warning sign. Erythrocyte sedimentation rate. This one measures how fast red blood cells settle in a test tube. The faster they settle, the more inflammation you probably have. But ESR takes longer to change, so it's not always the best for early detection. This measures how thick your blood is. More inflammation means thicker blood. It's sometimes a better indicator than ESR because it's less likely to give false positives. So what's behind chronic inflammation? Some causes are pretty obvious, like infections or autoimmune diseases, but lifestyle factors play a huge role. Things like lack of exercise. Stress literally causes inflammation. Poor diet, too much sugar, processed foods, and trans fats. Smoking and alcohol. Exposure to toxins like pollution and chemicals. Sleep deprivation. Basically, the way you live your daily life has a major impact on how much inflammation is hanging around in your body. The good news? You have a lot of control over your inflammation levels. Here's what you can do. Move more. Aim for at least 150 minutes of moderate exercise per week. Eat smarter. Fill your plate with anti-inflammatory foods like fatty fish, leafy greens, fresh fruits, turmeric, and ginger. Cut the junk. Minimize processed foods, trans fats, excessive salt, and sugar. Get quality sleep. Sleep deprivation fuels inflammation, so aim for 7 to 9 hours a night. Manage stress. Try mindfulness, meditation, or just taking time to relax. Quit smoking and limit alcohol. Both are major inflammation boosters. Consider supplements. Omega-3, zinc, and certain vitamins may help, but always check with your doctor first. Now, what if you get a test result that says your inflammatory markers are high, but you feel totally normal? Don't panic. These tests aren't a diagnosis. They're just pieces of the puzzle. Factors like age, weight, smoking, and even anemia can affect results. Your doctor will consider the bigger picture before deciding on any next steps. So there you have it. Inflammation isn't always bad. It's part of your body's defense system, but when it sticks around too long, it can lead to serious health problems. The good news? Small changes in your lifestyle can make a big difference. If you found this helpful, don't forget to like, subscribe, notification bell so you don't miss out on more health tips. Got questions? Drop them in the comments. and I'll see you in the next video.